Hello everyone, I am Dr. Sandeep Patel and today we will discuss on 4 phases to organize medical conference. If you are a doctor, if you are a medical professional and you are a part of organizing committee in a medical conference, so this video is for you to how to easily and organize your medical conference in a different phases and how you can improve your planning and execution for such medical conference. Let's see. So phase 1 will be your early stage planning. Second phase is registrations and abstracts. Third phase is scientific programs and speakers, and fourth, logistics and on-site management. So if we talk about the background, if there are different kinds of healthcare events wherein first is the conference, workshop, CME, CPD. CPD means continuous professional development and CME means continuous medical education. Seminar, webinar, medical trade show, healthcare expo, exhibitions, such kind of events usually you will see in a healthcare industry. So as a part of, we are taking it as a first case is medical conference. So if you are organizing such medical conferences, usually there are scenario is it is organized by different medical associations of in different specialties, subspecialties, associations. NGOs are also organizing medical conferences, and yes, medical institutes, colleges, they are also organizing such events. So overall, if we see, usually the organizers are medical professionals, doctors. They used to organize this event, and organizers are medical professionals, so they also have a day-to-day work. They have a professional schedule, clinical duties, as well as they are seeing patients as well, and along with that, in their busy routine schedule, they came across to organizing such medical conference. So today we are trying to simplify it in a way so that they can more better way organize their medical conference planning and execution part. So in a conference planning, we usually do with weekend meetings and delegating work among the different organizing committee members, and then you execute things along with different agencies. These are usual scenario we used to see. And as a part of completing organizing, if you want to make it in a better way, you should start it at least 6 months prior to your conference date. And now organizing medical conference has all these 4 phases in a detailed way. Phase 1, early stage planning. So what it includes in early stage? First, you finalize your conference title and logo. Then make a creative visuals, cover image, flyer, etc., so that you be ready with the first announcement. Event location, at least you decide a host city, which city you are coming up with the conference. Yes, if possible, you can decide venue, but in a later stage you can decide on the venue part. You can take time in that part. But yes, early stage must include your communication, which is, if you are planning a state or a national level conference, you need a website, and if not website, you can get an event web URL, unique URL, so that you can reach to your target audience, and wherein platforms like Docthub.com can help you out, create your event and list your event so that you get your URL, the unique link for your event. And after that, you should finalize your registration tariff and certain deadlines. At least offline registration form for the early birds you should be ready with, and get on board for online and offline registration platform. Like on Docthub.com, you get it both the solutions at one dashboard, so that once you come up with your first announcement to your audience, where usually we announce in a way that save your date, so your audience can be ready. They get first notification, they can book their dates also, And yes, this at the end of your early stage planning, you must be completing your conference title, logo, and yes, all your registration part should be prepared. And this phase 1, you should complete it in a 1 month. If you want to complete your entire conference planning in a 6 months, 1 month will be for your phase 1. So now on phase 2 will be your focus on registrations and abstracts planning and execution. So in a phase 2, you are completing your conference brochure, your abstracts guideline and application form, abstracts for poster presentation, oral presentation, video presentation, for the different kind of competition and different research work you are showcasing. So in this phase, you need to finalize guidelines and application form and define different committees and their roles. Committees like registration committee, scientific committee, posters and paper presentation committee, logistics committee and cultural committee. And finalized deadlines for the scientific submission, like people who want to present in that conference, you announce that, you give them guidelines like presenting for the research articles, paper presentation, etc. Then finalize the sponsorship brochure, at least the proposal, start communicating with the corporates, institutes, and then you promote registrations in this phase. All these things completed for the registration, attendee registrations things, what will be the tariff and deadlines, we have already finalized in phase 1. In a phase 2, we will be promoting the registration so that you can reach to your target audience, promoting by WhatsApp, SMS, email, social media. In this phase, you can explore Docthub events dashboard, which will help you to manage offline and online both the registrations at one place. In this phase, you need to finalize your event venue and also start planning for the after hour excursions, like what you want to include: gala dinner, site visit for your attendees or visitors, and the cultural events in during your conference. If you are planning, you should start planning in this phase, phase 2. And this phase, you will get a time of 1 to 2 months. You can take this time, but yes, not more than 2 months, because the next phase of scientific programs and speakers will be a most important part of your conference. In this phase, the phase 3, you should finalize your scientific theme and topics, identify and secure speakers and chairpersons of different sessions and different topics, finalize and circulate your scientific program once it is ready at the end of this phase. And as we have started abstracts, applications and all in a phase 2, so in this phase we need to finalize different extracts and notify all the applicants who have applied for different posters and paper presentation. We need to complete their applicants to be ready with their final presentation on the conferences. Also, you identify the requirement of your audio visual instruments, what will you need during your medical conferences, because for that you need to identify agencies and start negotiating in this phase. And yes, assign session moderators. In your scientific program, there are different sessions, so you must identify different moderators for particular session so that they can start working on detail level of planning of their each session, what the scientific programs and topics are being covered, and they can coordinate with the speakers and chairpersons. Also in this phase, you must design and order your materials kind of badges, kits, certificates, etc. So your design part should be ready and you must order for the printing part. And for the venue, confirm the meeting rooms, how many meeting rooms you will require, what the capacity of that meeting rooms, and things other required in the meeting rooms you need to confirm with the venue manager. And also finalize the food, the caterers and food menu should be finalized in this phase. So this phase you should allocate at least 2 months. If you have a time, you can take more time for planning and execution of this phase 3, but phase 3 will be a most crucial phase. So at least 2 months you will need to plan this phase. So make sure that your phase 1 and phase 2 must be completed in a timely manner, so that your phase 3 will be, you can plan and you can give a time in a better way. Now completely on-site and logistics management. So in this phase you need to note down your resource requirement at a venue. What will you require at venue? So there are registration desk, kiosk, wherein you will need attendees list, exhibition area, kiosk building, and the stall planning, layout, the corporate communication who are participating in that exhibitions. So you need to start communicating, finalizing them, allocating them particular kiosk so that they should be ready with their materials and etc. Then your audio visual instrument setups should be finalized, and the agency should be visited your venue. The catering agency, you finalize all your menu, the tariff, etc. Negotiation should be done in this phase. And traveling and housing arrangements for speakers, for your guest. So in phase 3, as we have designed and ordered all the materials, you must confirm it that you received your all printing materials, badges, the kits, certificates, and ship all the materials to your venue. And at last, on the prior day of your conference, you must arrange a pre-conference meeting and walkthrough with entire team. Entire team includes all your organizing committee, including registration, scientific committee, cultural committee. All the members should be there. All the agencies, their manager and their team should be there, should attend this meeting. And your venue team, venue manager and their team should be there. And you, the chairperson and secretary of this conference, should brief them each and every aspect, each and every areas, and the entire program should be walked through, so that everybody is on one platform, and they should know each other. Each of the agency should know your committee members, and for which work they need to contact particular person. So you should also assign the work delegation for different members. And this phase will be your last 1 month you should allocate it for this phase. So your last 1 month before the conference date will be include all such on-site and logistics management. So make sure your scientific programs should be completed before 1 month, all your planning and all. Most of the time we have observed that last moment there are changes in a scientific programs, and there are the situations where speakers or a guest or a chairperson last moment they change their schedule and somehow. So you should be ready with such surprises also in this phase. So manage your conference with Docthub. We all will be there for your phase 1 and 2. In that phase you can manage entire your things with Docthub events dashboard. You can visit to enterprise.docthub.com, our website, and contact the events team. The email ID is there, events@docthub.com, and you can contact on mobile. It is 83208-75943. So all the best, all the doctors who are organizing such medical conferences, and thank you very much.